Hello, Professor Carranza, and anyone on YouTube that stumbles onto this presentation. My name is Josue Gonzalez, and this is for HSC 101, and this is my critical assignment presentation on public health. I will be giving a presentation on the past, present, and future of public health. To start off this presentation, we ask the question, what is public health? Well, public health is a bit hard to define because there's so many aspects that go into what public health is. The definition that I would use to define public health is the way professionals prevent disease, give people the ability to extend their life expectancy, and promote health and education for the betterment of individuals and communities. The California Department of Public Health's definition of public health is improving the health of families, promoting healthy lifestyles, prevent diseases, and remove environmental dangers. Philosophically, public health is the belief that everyone in our population should have access to the right resources they need to live long and healthy lives. These resources can be made up of strong support systems and include organizations, agencies, and health professionals. Some of the core values of public health include being grounded in science, focused on prevention, and also being founded on health equity. Being grounded in science is a clear value of public health, as science governs the way we understand the human body and the things that hurt and help us. Prevention is another core value of public health because of how much effort is placed on acting in reducing the possibility of individuals contracting a disease and being afflicted by something. And lastly, health equity is a core value of public health because of the belief that all members of our society should be treated fairly and justly and deserve the right to have access to these resources to give them a better life. Several public health professionals use the term social determinants of health, or SDH, to describe factors that influence health outcomes that are not necessarily related to an individual's biology, such as genetics and a history of pre-existing disease. The CDC defines the social determinants of health as the conditions in which people grow, work, live, and age, and how these conditions shape everyday life. This figure to the right provides real examples of what the social determinants of health are and the health outcomes that they influence. So the first social determinant of health is economic stability, and this has to do with the person's employment, their income, their expenses, their debt, their medical bills, and any support that they receive economically. So how does economic stability influence a person's health outcome? Well, if a person has a stable job, they will have a steady income to pay for essential things such as a house, food, healthcare, several different things. And inversely, if a person does not have a stable job, then they don't have that money to pay for things such as a car, for insurance, and other things. The second social determinant of health, is the person's neighborhood and their physical environment. This includes their housing, transportation, safety, parks, playgrounds, the walkability of their neighborhood, and the zip code of where they live. So how does this physical environment influence a health outcome? Well, being in a safe neighborhood allows you to be able to walk outside and enjoy your neighborhood and the things around you. But again, if you live in a bad neighborhood, then you wouldn't feel as safe and you wouldn't go outside as much to go ahead and enjoy nature and things like that. The third social determinant of health is education. And this has to do with the person's literacy, their language, their early childhood education, their vocational training, and any higher education that they receive. So how does education influence health outcome? Well, if a person gets a higher education, they are more likely going to be applying for jobs that pay more than a job that doesn't require higher education. And again, if a person does not maybe even finish their high school degree, then they're going to have a harder time finding a job. So that's why education is also an important social determinant of health. The next one that we can look at is food. So food has to do with a person's access to healthy food options and even food at all. If a person doesn't have access to food, then they will go hungry and possibly die of starvation. So this health, this social determinant of health, again, can either positively affect you or negatively affect you. If you have access to healthy foods, then your health will go in a positive way. If you don't have access to healthy foods, then your health can go a negative direction. Another social determinant of health is the community and the social context in which a person finds himself in. And this has to do with social integration, support systems, community engagement, and discrimination. Again, how does this influence a person's health? Well, if a person has a strong community to support them during a health crisis, then the odds are that they're going to come out with a better outcome. If a person doesn't have anyone, any family or friends that can take them to hospital visits, then they're not going to have that support and they're not going to be able to have a positive health outcome. And the last social determinant of health is the healthcare system. And this has to do with the person's health coverage, if they have a provider available, if their provider understands their language and their culture, and also even the quality of care. So a good healthcare system will positively influence a person's health outcome. And again, a healthcare system that maybe does not understand their language or does not understand their culture, then their health outcome will result in a negative way. Let's look at the importance of health equity. The Office of Disease Prevention and Health Promotion defines health equity as the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Simply put, health equity is a fair opportunity to attain full potential health. So the Office of Disease Prevention and Health Promotion is the office in charge of Healthy People 2030. Healthy People 2030's vision is a society in which all people can achieve their full potential for health and well-being across their lifespan. And Healthy People 2030's mission is to promote, strengthen, and evaluate the nation's efforts to improve the health and well-being of all people. One of their main overarching goals is to eliminate health disparities and achieve health equity. So this is important for a few reasons. Health is considered a fundamental human right, and also having the highest possible level of health for all people is the most important worldwide goal. So now how In this section, we look at the roles of governmental and non-governmental institutions. When we look at non-governmental roles, we see how public health was influenced by pioneers such as Edward Jenner, John Snow, and Edwin Chadwick. Jenner used vaccination to prevent smallpox, which was eradicated eventually by 1977. And now vaccinations are widely used throughout the world and have prevented the spread of various infectious and deadly diseases. Snow used basic descriptive epidemiological methods to analyze patterns of deaths in a cholera outbreak. These methods help shape how scientists and epidemiologists track and detect disease outbreaks. If we look at governmental roles, we see how Edwin Chadwick was a leader of the sanitary movement, and he structured the government's role and responsibilities for protecting the public's health in England. In the U.S., Lemuel Shattuck, a legislator in Massachusetts and author of the report of the Sanitary Commission of Massachusetts, revealed the need for public health codes and government intervention. This report focused on health and living conditions in Boston, but had far-reaching impacts in bringing public health to the forefront of important national issues. According to several people, this was the first attempt to get public health code in place in a major American city. And lastly, we see Healthy People 2030. Again, Healthy People identifies public health priorities to help individuals, organizations, and communities across the U.S. improve health and well-being. What are the three core public health functions? Well, the three core functions of public health are assessment, policy development, and assurance. Assessment helps in identifying health problems within a community by collecting and analyzing information. Assessment assesses and monitors population health, and it also investigates and diagnoses hazards and root causes. So with this information, we can go into policy development. The information is analyzed and policies are developed and programs are developed to help address and solve health problems in the society. The way this is done is by effectively communicating and giving the public education to strengthen their health. Policy development also involves mobilizing communities and partnerships, and of course, creating and implementing these policies. Assurance then monitors the success and failure of these programs to see if they need to be further developed to better serve the health problems of a community. Assurance enables equitable access to healthcare and services, and it also builds diverse and skilled workforce. Assurance evaluates research to improve quality of care, and it also builds and maintains a strong public health infrastructure. This is a brief history of public health. So public health has had major achievements in the past century, and some of these achievements include vaccinations, control of infectious diseases, and safer and healthier foods. Vaccines have had a great impact on human longevity and health because they help teach the immune system to learn how to defend against foreign bodies that may cause infection and disease. A recent economic analysis indicated that vaccination of U.S. births with the current childhood immunization schedule prevented approximately 42,000 deaths and 20 million cases of disease. This saved nearly $14 billion in direct costs and $69 billion in total society costs. Another significant achievement has been the control of infectious diseases through the use of advanced laboratory techniques and technologies that help in identifying diseases, such as HIV. HIV testing and health screening of various sicknesses and diseases has also helped in the control of the spread of infectious diseases. A significant environmental achievement is motor vehicle safety, in which we have seen a significant decline of deaths by motor accidents. This is a result of safer vehicles, safer roadways, and safer road use. It has been clear that legislation has positively influenced seatbelt use and child safety. One of the greatest achievements of public health has been tobacco control. Since the first publication of the first Surgeon General's report on tobacco in 1964, evidence-based policies and interventions by federal, state, and local public health authorities have seen the consumption of tobacco use reduce significantly. These efforts have resulted in smoke-free work sites, smoke-free restaurants, and also various smoke-free public spaces. The Food and Drug Administration, or FDA, gained authority to regulate tobacco products, and they continue to propose effective warning labels on the danger of tobacco use with the hope of a significant increase in people trying to quit. Here I've created a history of public health timeline when we can see significant events that have happened in the past century. In 1902, the Principles of Sanitary Science and Public Health was published. In 1923, the first diabetic patient was treated with insulin. In 1943, the USDA announced the basic 7 foods. In 1945, we saw the first fluoridated water community. And in 1948, the World Health Organization was founded. In 1951, malaria was eradicated in the US. In 1955, we saw Salk's polio vaccine, which helped hundreds of thousands of people. In 1963, vaccines were developed for measles, mumps, and rubella. In 1964, the U.S. Surgeon General's report on smoking and health was published. In 1965, Medicare and Medicaid were signed into law. In 1966, we saw the Highway Safety Act and National Traffic and Motor Vehicle Safety Act be enacted. In 1970, Occupational Safety and Health Acts were enacted. This is known as OSHA. In 1976, we saw the enactment of the Toxic Substances Control Act. In 1976, the Toxic Substances Control Act becomes law. In 1984, the first state seatbelt law passed in New York. In 1990, the Nutrition Labeling and Education Act was made. In 2010, Obamacare was signed into law. The current challenge or issue that the field of public health is facing is a chronic lack of adequate resources. One of the resources that is inadequate is an aging workforce that is also at times inadequately trained. However, ways we can overcome this challenge are creating mentorship programs where seasoned practitioners help train recent graduates. We can also find out the weaknesses of our workforce by creating surveys for patients about any shortcomings that they've experienced with public health professionals when they've been treated, and then evaluate how we can improve in these areas. Another resource that is inadequate is funding streams that are not flexible and are at times insufficient. This issue can be addressed by petitioning for stable governmental funding by presenting the importance of public health. We also see how the information infrastructure is not sufficient in meeting the increased demand for large data management needs. This issue can be addressed by adopting data systems that are used by efficient and prominent healthcare systems. I believe that the most important public health achievement in the next 25 years is going to be a public health workforce that is diverse and adequately trained to serve underprivileged populations and general populations as well. This is important because individuals and communities feel safer and more willing to come in for help when the workforce is compassionate towards them and knows the background that they come from. Having an adequate training on how to work with underprivileged populations is important to help achieve this Language courses, culture classes, and best practices for diverse people groups are essential in making sure the public health workforce of the future is adequately trained to serve underprivileged populations. So, practical ways we can achieve this are by developing undergraduate and graduate programs to include diversity training and instruction. We can also create incentives for future public health professionals that are from diverse backgrounds themselves to join the field. In conclusion, public health has made a significant impact on the health of populations throughout the world and in our own communities. Public health is the science of protecting and improving the health of people and their communities. And this is accomplished through three core functions, which are assessment, policy development, and assurance. Public health desires for all to achieve optimal health, as well as giving everyone the fair and just opportunity to achieve health and well-being. Thank you for listening.